Well, once again, thank you guys for coming today. I'll go ahead and dive right in. As Fred said, today we're looking at complementary therapies in cancer care and exploring this general field for a very unique, diverse urban population, specifically for the population served by Little Red Door. So we'll start out with some general information. Why is complementary therapies important? Why are we reviewing this topic? As some of you may be aware in this room, cancer is the second leading cause of death worldwide, with 19.3 million new cases expected by 2025. Also, of the 14.5 million cancer survivors in the U.S., it shows that this issue is not only prevalent and in folks that are going through active treatment, but some cancer survivors experience symptoms up to 50% of them long after survivorship. So this is an issue that not only affects patients at the present time, but in the future as well. So complementary therapies are non-mainstream health approaches or techniques that are used alongside conventional treatment in order to help manage those hard-to-manage symptoms, again, that can last well into survivorship. And up to 50% of patients undergoing active treatment use complementary therapies today. So it is prevalent, but we do still have a long way to go in the field of complementary therapies. So today we'll go over some of that research and see where we are. The field of complementary therapies, there's been quite an evolution in recent years. Some of you may be familiar with the acronym CAM, or Complementary and Alternative Medicine. And under CAM, there used to be a wider array of domains of different complementary therapy types, including energy medicine, whole medical systems, manipulative and body-based practices. However, since then, alternative therapies, the research and medical community found that they overall lack biological plausibility and efficacy of cancer treatments, as alternative medicines were really meant to be an alternative to conventional treatment. So since then, this field has changed their prominent acronym to CIM, or Complementary and Integrative Medicine, which really just encompasses therapies that are meant to be used alongside that conventional treatment. Again, the purpose of complementary therapies is not to cure cancer, it's again to help with symptom management and overall improving quality of life for those that are having cancer experiences. Under the new CIM acronym, the therapies have been condensed into two main groups of natural products and mind-body therapies. Natural products, they're a group of complementary health approaches that include all things natural. So herbs, probiotics, supplements, vitamins, everything like that. Herbal supplements and natural products are actually the most widely utilized complementary therapy in the general population worldwide. They're also more popular among Latinos and other racial groups. Popularity is likely due to increased access. So not necessarily due to increased effectiveness, but the fact that herbal remedies and supplements and vitamins are available at any Walmart, drugstore, grocery store. And also there seems to be a high perception of safety around herbal products and natural products. People perceive because they're natural that they couldn't have any sort of harmful effects. However, the National Center for Complementary and Integrative Health, which is the federal government's leading agency on complementary therapies, their kind of formal stance on natural products is that some of the largest, most rigorous studies have proven these effects or these products don't always work. There are indications that some may be helpful, but as far as applying them to cancer populations in general, they could have some potentially harmful effects when combined with conventional treatment. So for the purpose of this presentation and for this project, we kind of stay away from natural products, as you will see. Mind-body therapies is where most of the research is focused on in complementary therapies. And mind-body therapies kind of encompass all the rest of the therapies. So they must be taught by a trained or certified practitioner. And this includes yoga, chiropractic or osteopathic manipulation, everything to acupuncture and massage therapy. This is kind of the inclusive list that's been approved by the NCCIH as mind-body therapies that can be applied in cancer care for help with symptom management. And mind-body therapies, they're called mind-body therapies because they're based on the belief that the physical wellness and physical health can be improved by interactions between the mind and the body. That's why so many of mind-body therapies encompass relaxation techniques or meditation techniques and kind of study that behavior and the effects it has on physical well-being. Women are almost 4 times more likely to initiate mind-body therapies than men. And not only are mind-body therapies helpful during active treatment, but up to 52% of cancer survivors continue to use their mind-body therapies that they initiate during treatment up to 24 months after diagnosis. So very popular and effective. And the NCCIH confirmed stance on mind-body therapies is they're fully supported as part of a multidisciplinary cancer care approach, specifically for reducing anxiety, mood, sleep disturbance, and improving overall quality of life in patients with cancer. So that's kind of a brief overview of the two main areas. However, I do include this extra, I call this the honorary mention, mind-body therapy, because it's not formally included in the list released by the NCCIH. However, there is a large body of research supporting its effects in cancer populations, and that is spirituality and prayer. There are conflicting views between patients and healthcare practitioners about whether this should be considered a complementary therapy, which is why it's probably not included on the formal list. However, prayer for health reasons was added in 2002 to the National Health Interview Survey, which is one of the largest health interview surveys in the country. And during that 2002 year, the respondents, 26% indicated that not only they use prayer as a mind-body therapy, but that is the sole mind-body therapy that they use. So that's pretty huge, from not including prayer at all to having 26% indicate it's their sole mind-body therapy is quite a jump. And even 38% still used prayer in conjunction with other therapies. Only 36% indicated this was not a therapy that they use. And today, in the field of mind-body therapies, 64.4% of all mind-body therapies include some sort of spiritual technique. And there is a difference between spirituality and religion, and I'll go over that in a little bit more detail. But just wanted to, again, include this as our honorary mention, mind-body therapy. So what do we really know about complementary therapies today? So as I said, there is research, a good body of evidence around complementary therapies, but it's still a work in process. Among cancer populations in the United States, we have seen usage of complementary therapies grow quite a bit, from 1980 and 25% to almost 50% in 2000. Now we have kind of hit a plateau a little bit. As of 2015, we're still hovering around 50 to 51% of cancer patients using complementary therapies during active treatment. But still quite a jump. The most common users of complementary therapies are young Caucasian females with higher education and overall higher income levels. And most likely this is due to the fact that many complementary therapies are not covered by insurance. So there is an access barrier for individuals, and this actually plays a huge part in this project due to the nature of the client base of Little Red Door. There is a gap in the research. When we have a certain therapy or a certain condition that's research is only focused on one population, it can be difficult to understand how to properly apply that within diverse populations. So some of the common reasons that patients indicate seeking complementary therapies or their anticipated outcomes of complementary therapies also kind of indicates to us how research is lacking and how the knowledge of the nature of complementary therapies is lacking in the general population, specifically around anticipated outcomes. Even though we know that the true nature and purpose of complementary therapies is really for symptom management, only 12.8% of cancer patients indicate that that is their anticipated outcome of engaging in complementary therapies, whereas 43.6% engage in complementary therapies anticipating that it might cure cancer. So that kind of is very indicative to us that we still have a long way to go with educating the general population on this field and how we can truly utilize this in cancer care. So for this study, I did started with an extensive literature review of over 80 studies that include randomly controlled trials, systematic reviews, meta-analyses, that were published between 2004 and 2016 to kind of determine what are the most popular complementary therapies that are used today, what are the most effective complementary therapies that are used today, and what are the top symptoms that for which cancer patients seek complementary therapies. Why are they reaching out to this field? So the results are here. So acupuncture, massage, mind-body therapies in general, yoga, spirituality, and exercise in general were some of the top therapies that are mentioned in the research or supported as being effective complementary therapies in cancer care. In addition, these are the top 5 symptoms that were supported in the research as not only the reasons that patients will seek complementary therapies, but symptoms that can be effectively treated by complementary therapies. So these are the areas that I'm going to focus on a little more in depth in this review. Now, we're going to start with therapies. I will warn you, we do have quite a bit of statistics kind of packed into this presentation. So I'm going to try and get through them and make sure that nobody gets bored or falls asleep, okay? So we'll start with therapies. We'll start with acupuncture. Acupuncture is the practice of applying needles, heat, or pressure, or other treatments, some might have heard of other things, to several spots known on the skin as acupuncture points. Acupuncture is an ancient Chinese practice that has been delivered in the US for over 200 years, but not until 2002 were acupuncture needles actually approved by the FDA. So we still generally a newer therapy, so specifically in cancer care. And acupuncture is based on the belief that a vital qi energy, balancing this energy through this practice is ultimately going to lead to better physical health and wellness. So two of the symptoms that are actually studied the most in acupuncture and cancer care are hot flashes and nausea and vomiting. So in one 10-week study, acupuncture treatments were able to reduce hot flashes by almost 60% in the cancer patients, which was great. And this is specifically on female breast cancer patients. And Cooperman scores, which is another measure used in cancer care around measuring hot flashes and severity and frequency, they were able to improve Cooperman index scores by 44% from baseline in a 10-week period. Pretty significant. In addition, for nausea and vomiting, one of the bigger studies indicated that only 10 days of acupressure treatment was able to decrease and delay nausea and vomiting better than placebo acupressure and standard treatment alone. So pain was the other symptom that was very heavily studied in acupuncture, and it's proven to be effective. Again, different for different types of cancer sites and different populations, but in general, there's quite a bit of research proving its efficacy in this area. One 8-week study on musculoskeletal pain found improvements in pain severity and functioning after only 10 treatments compared to controls. Another study on postoperative pain in cancer patients found that incorporating acupuncture to an existing massage therapy routine was more significant and effective in controlling pain than massage alone in 67.4% of patients included in the study. So that's kind of an overview of acupuncture there. We'll move along to massage. Some of you may be familiar. Massage therapy involves applying pressure to muscle connective tissue to reduce tension and pain, improve circulation, and encourage massage. In cancer care, some of the most common forms of massage therapy that's used include Swedish aromatherapy, reflexology, and acupressure. And then massage therapy in oncology usually is focused on alleviating symptoms around anxiety, depression, and pain. So the first studies here kind of support that theory. One 5-week study found that 3 30-minute massages per week were effective at reducing pain, anxiety, and depression. And then another study found that just 2 30-minute massages of the head, neck, and back per week to also have significant improvements in pain, fatigue, and anxious depression. And you can see in the first statistic that they actually had significant results in long-term depression, which is huge. Many complementary therapies, even short-term improvements are a big success, but having effects on long-term depression is a significant feat. Some other areas that have been studied and proven to be effective through massage therapy are quality of life. This study is specifically in breast cancer patients found that one 60-minute scalp or reflexology massage per week was successful at improving quality of life and anxiety scores in standard care. And then this smaller study below actually saw improvements in sleep scores. So patients were able to get longer periods of sleep, deeper sleep, better quality sleep from engaging in regular aromatherapy and massage, as well as improvements in depression scores. Moving right along to yoga. So yoga, I do have a category on exercise in general, but there's so much evidence around yoga in cancer care that I thought that it deserved its own category. So yoga is also a unique mind-body therapy in the fact that not only does it have the exercise components of physical movement and physical activity, but it also incorporates a lot of meditation and relaxation techniques. Relaxation techniques on its own have been proven to be very effective in cancer care. So combining the two can be very powerful for this population. Some of the common symptoms or other benefits that cancer patients may receive from yoga are improvements in nausea, pain, appetite loss, and benefit finding, which is very important during a cancer experience. So making sure to find benefit and peace in the experiences that they're having is huge. Also, one of the great things about yoga is that yoga is very highly utilized in the general public as well. So one of the reasons it's so popular within cancer care is there's a lot of patients that go into their cancer experience having done yoga at least once or twice in their life before, and might be very likely to continue that practice after or into survivorship. So some of the studies around yoga, actually one review of over 200 articles on integrative therapy specifically for breast cancer patients, which we know is very pertinent to the Little Red Door population. The Society for Integrative Oncology released guidelines on specific integrative therapies for breast cancer patients and awarded yoga and meditation the highest grades of recommendation for reducing anxiety, fatigue, and improving mood for patients undergoing radiation and chemotherapy. In addition, another 6-week study done on yoga and meditation found that 3 one-hour sessions per week led to significant changes in anxiety, depression, and perceived stress. Now, 3 hours of yoga per week can be sort of significant, so I included some of these other studies that show that even smaller amounts of yoga can help. One 12-week study on yoga and meditation found that just an hour and a half of yoga per week led to significant changes in social well-being, quality of life, and distress. And then the following study, which was extremely interesting, found that yoga for 6 weeks, only 90 minutes for 6 weeks, led to actual changes in DNA cell damage, along with changes in anxiety, depression, and stress scores. So that kind of is really indicative that this can be a very impactful therapy for this population. Spirituality, our honorary mention, mind-body therapy. So spirituality and religion have been linked to several measures within oncology, such as patient adjustment, coping skills, and mood and depression. Now, kind of how I mentioned earlier, there is a difference between religion and spirituality. Whereas religion is very culturally determined and mostly associated with feelings of, or attitudes about God or attitudes about themes that belong to an organized religion. Spirituality is really more associated with a feeling of inner peace and inner meaning and self-awareness, and that can very easily be expressed outside of religion. And it's very interesting in the literature to see how religion and spirituality have different effects within this population. So these first 2 studies just talk about the general effects. A study examining religiousness and anxiety by disease stage found that patients in the end of life stages, so they have the lowest quality of life, found that those in that category, those that had the highest intrinsic religiousness scores had the lowest anxiety scores of patients in every disease state. So they found that very interesting that that religion could play a specifically significant role towards end of life, which is particularly important for any cancer patients that may have a terminal diagnosis. And then another study, now this was specifically done on male low-income cancer patients, over 200, found that lower spirituality scores in peace and meaning and faith were associated with lower physical and mental health. That was one of the only studies I found specifically on male cancer patients and specifically low income. So I thought that was very interesting to include. These 2 kind of highlight what I spoke about before, how religiousness and spirituality, religiousness in particular, can sometimes act as a comfort and a protective barrier for those in their cancer experience, and sometimes can really be harmful to especially depression and stress and anxiety levels. One year-long study in 418 cancer patients found that high levels of meaning and peace decreased depression levels over that year period, whereas high levels of religiousness had the opposite effect. Another study of 85 hospice patients with cancer found a negative correlation between anxiety and depression, and spiritual well-being. So the higher spiritual well-being, the lower anxiety and depression, but no relationship with religiousness. And the literature states that this might be because individuals who go into a cancer diagnosis with a very high religious affiliation or religious feelings or viewpoints sometimes struggle with their religious affiliation and their faith in God when they're going through this religious experience. So sometimes that can be a huge source of stress for them. And it's not really quite sure how best to approach that. Exercise. So I saved this one for last, not only because it's very inclusive, but also because exercise and physical activity is the only complementary therapy that has the potential to improve survival. So that is huge. Research suggests that physical activity is a preeminent goal of any integrative oncology plan, and its importance cannot be overlooked. And interventions can be beneficial during active treatment as well as into survivorship and even as a pre-cancer complementary therapy, so into cancer prevention, with increased effectiveness for interventions that use moderate to vigorous activity levels. So the first study indicates, which is another huge thing, that exercise interventions can be more effective in patients that are undergoing active treatment, which is great. One large meta-analysis found that patients in active treatment report a 31% greater change in physical functioning, so the ability to move and operate on a daily basis, than all other groups after 12 weeks. Now, significant changes in social functioning were exhibited in all groups, so meaning groups that are not going through active treatment or groups that are in survivorship. But it's a really great thing that those that are in active treatment and most vulnerable can see an increased change while participating in these. Strong evidence also supports exercise as having immune-boosting qualities for cancer patients by stabilizing or increasing cytokine and lymphocyte production, which can ultimately increase white blood cell counts and affect cell activity, which can slow tumor growth and dissemination. So that's huge, kind of relating back to some of the information we found on yoga. Exercise interventions also report some different effects with different cancer sites, specifically around breast cancer. Now, again, that same large review, which included over 5,000 adult cancer patients and over 50 different exercise interventions, found that for breast cancer patients, changes in anxiety occurred quicker than other cancer sites, sometimes not at all in other cancer sites, or if there was, it was only able to be detected using 2 measurement tools. However, on the flip side, when measuring health-related quality of life, which is huge and encompasses many domains of health, this was seen in 35.5% of participants after 12 weeks, and in a majority, 87.7% of participants after 6 months. However, these effects were not significant within breast cancer populations. So when dealing with this population, especially with exercise, we have to be very careful as to where we're directing those efforts and making sure we're paying attention to what the expected outcomes are for that population. So moving on to common symptoms. So stress and anxiety, just to reinforce what we had talked about earlier with the different therapies, mind-body therapies have proven to be very successful at reducing stress and anxiety within any, cancer patients at any stage of survivorship, from less than a year after diagnosis to up to almost 5 years after diagnosis. So that's huge. Massage therapy, again, has been one of the top therapies that's been used to treat this. Found that even just 20 minutes of gently stroking the foot or the leg or the hands and arms during chemotherapy infusions to significantly lower anxiety. So it's so effective that it doesn't even need to be practiced by a licensed or certified professional. This could be self-administered or administered by a caretaker to have benefits for this population. Relaxation and guided imagery techniques have also been proven to be extremely effective, specifically with breast cancer populations, in reducing stress and anxiety, and even have a protective effect against cancer growth by increasing T cell and LAK, so killer cell activity. Exercise interventions are also proven to significantly reduce anxiety, as we kind of talked about before. So when we're looking at anxiety and breast cancer, exercise is a good way to go. I included some of these. This is an example of a potential clinical registry for an integrative oncology program. And these researchers included many different types of therapies to reduce stress and anxiety. So this is just offered to give us some perspective that some may be more effective, but there's a lot of different therapies that we could potentially explore as research continues into treating this condition. I also included measurement tools just to indicate that there are so many different ways to measure this one specific symptom. It makes it difficult, especially in the world of complementary therapy where research is still advancing, to really determine which are most effective. So studies on pain, this is a big one and has received a lot of attention in cancer care as well. Acupuncture, as we kind of mentioned before, has been proven to be effective in several different populations to help with cancer pain. One study found that only 7 days of electroacupuncture was able to reduce patient-controlled analgesic morphine levels up to 2 days after surgery. So that's huge, being able to cut back on pain medication up to 2 days after surgery, just after 7 days of acupuncture treatment. speaks volumes. And then a study on other postoperative cancer patients found that acupuncture treatments were able to reduce pain intensity by 36% over 8 weeks compared to only 2% in the control group. So again, really speaks to the efficacy of this. Spirituality has also been associated with pain relief, specifically associated with patients' ability to still enjoy life regardless of high levels of pain. And massage has proven to have some efficacy in pain control as well. One study found that 2 30-minute massages per week were not only able to help control pain better than the control group, but was able to sustain that pain reduction for up to 11 weeks post-intervention. And this is, again, just an example from a potential clinical registry of what other therapies have also been aimed at pain control within cancer care. And just an example of some of the most common measurement tools that were used in the studies reviewed. So fatigue. Fatigue is kind of a tricky one. As you can imagine, patients that are going through active treatment, it's almost impossible to find treatments that can really help them function better and feel more awake and resume with their daily life. However, massage has been proven to be effective in this. One study, a smaller study, including 86 patients, found that 2 30-minute massages were able to significantly reduce fatigue compared to controls. And again, exercise intervention was able to report improvements in fatigue after just 12 weeks across all cancer sites except for breast cancer. Again, that's the tricky one. Acupuncture has proven to have some effectiveness in fatigue as well. One study in over 300 patients found that 6 weeks of acupuncture improved fatigue in all areas assessed. So that measurement tool had several domains of fatigue, including physical and mental fatigue. And then I included this section on creative writing. I felt like it was very applicable. This does not have to be taught or administered by a trained or certified professional. Creative writing is something that anyone can do at any time. And there were several studies that talked about creative writing. This one in particular talks about breast cancer patients. Again, that tricky population found improvements in fatigue scores were significantly changed after only 4 creative writing sessions. So I thought that was pretty interesting. Again, other therapies, examples of other therapies that have been aimed at reducing fatigue in cancer populations, and an example of the wide array of measurement tools that can be used. Depression. So that same review that we talked about before that released guidelines for integrative therapies for breast cancer patients awarded meditation, relaxation, and yoga the highest grade of recommendation for relieving depressive symptoms, and massage therapy the second highest grade for reducing depressive symptoms. So these are very proven to be effective techniques in addressing this issue, specifically with that population. Supporting those guidelines, a 6-week study on yoga and guided imagery found that 90 minutes per week of this combined therapy to have significant changes in anxiety and depression scores. Again, we see massage therapy here as being effective in only 2 30-minute massages per week, again, to significantly improve anxious depression scores. And again, with the creative writing, another very large study including over 500 cancer patients found that writing about a traumatic or distressing event for 20 minutes every week had significant improvements on depression. So again, kind of an interesting, not something we normally think about when we think about complementary therapies. And just an example of some measurement tools. Quality of life. In some regard, quality of life almost deserves, you could write a totally another paper on quality of life, seeing as the nature of complementary therapies is to not cure cancer again, but help with symptom management and make their cancer experience more tolerable. So I do go into a little bit of detail for those of you that might not be too familiar with quality of life. Quality of life includes several domains of health. The idea is that physical, psychological health, economic health, social health, and spiritual health are all integrated to paint an overall picture of well-being in that patient's life. Now, there is a quality of life model and a health-related quality of life model, which you'll see represented as HRQOL. And HRQOL is only different in the fact that it doesn't normally include things like economic health and social health. It's really more focused on physiological wellness. And you'll see both represented within complementary therapies research. And why is this important? It's really important because, especially in cancer care, we're shifting away from a biomedical model into more of a biopsychosocial medical model. Because sometimes we're not always treating patients for survival alone, especially those that have a terminal diagnosis. We're really treating them to advance their quality of life and, again, make them more comfortable. So this model is really more appropriate when it comes to complementary therapies. So some of the therapies that have been proven to be most effective, massage is a big one. One 8-week study found that 60 minutes massage per week to have significant improvements in quality of life compared to controls. Another study looking at gentle yoga for 2.5 hours found that this improved quality of life scores in several different domains, including mental composite, general health, mental health, social functioning, and overall vitality. Positive religious coping mechanisms such as prayer, positive affirmations, prayer and support groups has also been found to improve quality of life scores on the McGill Quality of Life Questionnaire, which is one of the more common measurement tools used to measure quality of life. And acupoint stimulation, there were a few studies that talked about improvements in quality of life, including one in over 300 breast cancer patients that found that one 20-minute session per week was able to improve over quality of life scores. So that is pretty significant. So as I mentioned, although you just experienced so many different facts and a rather wide array of research on complementary therapies, research in complementary therapies is still a work in progress. So some researchers are asking, why is research in complementary therapies important? Why should we be making this a priority? It should be a priority because the more cancer patients that are engaging in complementary therapies, the more we need to understand how they interact with conventional medicine. We need to assess which theories are actually effective at treating these cancer symptoms. We need to test them against other already accepted treatments to see which ones are more effective. And overall, especially some therapies that have global origins, such as acupuncture, in more developed countries or Western medicine, we really need to do more research into how these actually work and verify their safety, as well as cost effectiveness. As we kind of talked about before, these therapies are often not covered by insurance, so there are a lot of access barriers. So how do we make these more accessible to patients that are in need and those that can really benefit from them? Why are there these barriers? What are some of the most common barriers in advancing research? There are several, including difficulty designing appropriate clinical trials. Again, in Western medicine, some of these therapy techniques are still being newly introduced and approved, so making sure that we're designing those trials properly, as well as funding for research. Limited time for medical doctors and complementary therapists to work closely together. I'll discuss this a little bit further in the following slides, but you don't often see medical doctors and complementary therapists working together, especially when we're talking about complementary therapists like massage therapists or aromatherapists, or there's not really a lot of interaction there. Lack of complementary therapists with research experience and knowledge. Again, an acupuncture practitioner or a massage therapist might not have the formal research knowledge to know how to initiate and conduct a formal clinical trial. So that definitely sees itself as a barrier, as well as difficulties finding a control group. It's very difficult to find individuals who are going through a cancer experience who are willing to participate in a trial where they might not receive any benefit. So that's a very difficult population to try and find a control group within this setting. So as I mentioned before, the National Center for Complementary and Integrative Health is the federal government's leading agency on complementary health and complementary research. So this flow chart, I guess I'll call it, is taken from their strategic framework or their strategic plan for 2016 in advancing complementary medicine. So all of these objectives together, what they propose as far as supporting this process and supporting the advancement of these objectives is supporting an integrative oncology program or an integrative oncology care model. Now, I've included the actual definition because I thought that this was a very comprehensive definition of what integrative oncology practice is, and it's mainly targeted at improving patients' and caregivers' quality of life, fostering doctor-patient communication regarding patients' physical, emotional, and spiritual concerns, and alleviating cancer symptoms, as well as chemotherapy and radiation side effects. Sounds a little bit familiar to quality of life, right? So integrative oncology combines two very innovative elements. The first priority is making sure that we're putting efforts towards advancing evidence-based medicine to support the efficacy and safety of these complementary therapies, but also an emphasis on multidisciplinary discourse between integrative therapists and clinical oncology practitioners. So really making sure that those two entities are working together to create a collaborative effort towards treating these patients. However, currently, there are several barriers to integrative oncology and therefore barriers to the overall NCCIH strategic framework. that are very important, especially for organizations like Little Red Door who are looking to advance complementary therapies and incorporate them into their offerings. So there are barriers to integrate the integrative oncology model that are presented from the patient perspective, the doctor or the oncology team perspective, and the complementary therapist perspective. As far as patients are concerned, at this time, up to 77% of oncology patients do not disclose their complementary therapy usage to their oncologist, which presents a huge problem, as you can imagine, from a safety and efficacy standpoint. We still don't know a lot about the interactions between conventional therapy and complementary therapies, so that can pose a huge issue if oncologists are not aware of that. Part of the reason, or one of the largest issues, is because patients expect their oncologist to be the one to recommend these therapies. So when that conversation is not initiated by the oncologist, sometimes those conversations get put to the wayside. Other research supports the fact that particularly low-income cancer patients, up to 50% of them were not even aware of the field of complementary therapies. So they might be aware of, specific therapies such as yoga or acupuncture or massage, but they were not aware that those could help manage their symptoms of cancer. So in addition, if a patient is not even aware that this field exists, slim chance they're going to bring it up in their oncology visit. Health literacy, which is the ability to obtain, process, and understand basic health information, also poses a huge barrier in the world of complementary therapies. Patients that have lower levels of health literacy have been proven to be less likely to initiate complementary therapies, less likely to initiate conversation about complementary therapies, as well as oncologists with patients with low health literacy levels are much likely to initiate that conversation with them. Likely due to, if you have a patient that has low health literacy, explaining their conventional treatment and the side effects and proper adherence can be challenging. So adding on another therapy on top of that can sometimes, present a challenge that they might deem as unnecessary. And health literacy, which we'll go into a little bit more, can be directly related to income level, education level, and age. Age really more so, as you can imagine, the older the patient, sometimes it's more difficult to really understand and take away that information from your clinical visit and agree on what was discussed. So some of the barriers that are brought to this situation by the oncologist or the oncology team, the most common reason for non-disclosure is the lack of initiation of this conversation from the oncology team. However, this is something that we really want to promote, and we want to, research shows that discussions of complementary therapies and initiating that conversation ultimately leads to a better doctor-patient relationship. For example, the ratio of doctor to patient talk in visits that include discussions of complementary therapies is 1:6 versus 1:2 in those that do not include complementary therapy discussions. Also, patient psychosocial and lifestyle statements were up to 49 statements in clinical visits that included discussions of complementary therapies versus only 28 in visits that did not discuss complementary therapies. So that's huge. The more that a patient is able to divulge or share with their doctor about their lifestyle and their personal life and their personal attitudes and beliefs really does strengthen that overall doctor-patient relationship. In addition, research proves that conversations with clinicians about these topics not only result in better client satisfaction or patient satisfaction, more patient decision-making, which is very important specifically as it relates to better treatment adherence. When patients feel like they have a more active role in their treatment plan, they're more likely to follow that treatment plan more or properly, which ultimately, maximizes the effectiveness of those treatments. And then as far as complementary therapy barriers, we don't see a lot of complementary therapy practitioners reaching out to oncologists on their own. This is due to, a lot of times there's no formal communication system, but also if the patient is not willing to discuss their complementary therapies with their oncologist, it's not really appropriate for that complementary therapist to always be reaching out to the oncology team. So kind of to support this research, a survey was done at a large complementary therapy ethics and law conference. The survey included 781 complementary practitioners and 438 oncologists. And this survey was used to assess this particular issue of communication. Who's really responsible for initiating this conversation? One question was asked, are patients interested in oncologists and complementary therapists communicating about their treatment? Overall, more complementary therapists agreed than oncologists. However, it's still kind of low levels. I don't think these practitioners are really sure whether that's something their patients are interested in. However, that doesn't necessarily mean that it shouldn't be happening. Another question asked should communication be conducted for mutual patients? And a majority of both practitioners, complementary therapists, and oncologists agreed that regardless of patient interest, this is something that should happen in order to increase effectiveness and safety. Most practitioners agreed that this communication should be in the form of a written letter. More doctors agreed, 73.8%, than complementary therapists agreed. And a majority of both practitioners agreed that this letter should be initiated by the complementary therapist. So this was very interesting. It's something that can be used in applying a formal complementary therapies program within other organizations. This survey also was used to measure what are the important elements of a letter from the complementary therapist to the doctor. And again, this was surveyed by both parties. And the 4 leading elements that should be included in that formal communication include complementary therapy diagnosis and explanation of terminology, possible clinical or interactions between their conventional treatment and their complementary therapy treatment, description of the overall treatment plan and the goals of that treatment plan, and then the quality of the supplements or the treatments. So really the specifics of what is it exactly that is being administered to this patient. So again, this is so crucial because, as the research supports, without this interaction, it's really impossible to have a really integrated treatment plan that's truly comprehensive, and really it all leads up to benefit for the patient. So we really need to be working together to support that kind of model. Again, this sort of communication model not only supports the safety and efficacy of the treatment, it supports an integrative treatment and ultimately leads to a patient-centered treatment approach. So how does this all relate to Little Red Door? So as some of you, again, may be aware, Little Red Door does offer a complementary therapies program, the Door to Wellness program. In 2015, over 1,700 clients received complementary therapies through Little Red Door. And this includes everything from therapeutic massage, oncology-centric yoga, to some other components that we include under Door to Wellness. So one of the important things we've learned from the research, as we said, there's truly a gap in the research, seeing as most research on complementary therapies is done on a very specific population, educated, more affluent Caucasian females. So we have to really look at who are the patients or who are the clients that we're treating here, and how can we make sure we're molding these programs to be most appropriate and efficient for them. Of the patients, clients that were seen by Little Red Door in 2015, we have a very high female population. We also have a very racially diverse population. According to this breakdown, now 10% of respondents did not include their race in the information that I received, but of those that did report, it's basically half and half, Caucasian and racial minorities. So that's a very racially diverse population. Another analysis that I did using a Savvy technology system through the Polis Center at IUPUI, which uses which organizes and analyzes health information by geographic region. I was able to highlight the 5 zip code areas that are most heavily served by Little Red Door clients. So they have the highest population of Little Red Door clients of any of the zip codes in Marion County. So there they are on the map. And then what I've done with this chart is I've taken aggregate information from those top 5 zip codes and compared them to national and state data for some of the social determinants that we should really be paying attention to as they relate to complementary therapies. So the first is racial minorities. You can see that of those 5 zip codes that are the core market for Little Red Door clients, we have a highly racially diverse population. The second statistic under poverty, that represents the percentage of adults, or percentage of the population aged 16 to 65 that are living below the poverty line. So you can see that it's much higher within those 5 zip codes as compared to state and national data. And then we looked at 2 different areas of education. So you can see that for both of them are individuals older than 25 or above age 25 that have less than a high school education or only a high school education and no college education. So you can see that not only do we have a very racially diverse population, which has its own implications around which complementary therapies may be appropriate, but also just generally tells us we do not know based on the research how effective these will be in this population. But also in regards to the research supporting how much health literacy has an effect on these therapies, we can see between the combined income level and education level data that we can expect there are relatively low health literacy levels within this population that we're serving. And then just did a general breakdown of the type of cancers that are most prevalent in the Little Red Door population. We can see we have a high percentage of breast cancer patients. And as we know from the presentation, specifically in complementary therapies, breast cancer populations can be a little bit tougher, and we have to be a little bit more strategic when deciding what complementary therapies we're going to use for that population. And this is just a general overview. I won't go through this, but cancer rates in Indiana compared to the rest. So you can see that breast cancer for the state, I know that there are very specific statistics around breast cancer in Marion County, but for the state, it might not even be on our radar really. So, but just something we really need to pay attention to within Marion County and specifically within the Little Red Door population. So based on the information we know about our client base and on the information that we now know about complementary therapies, I wanted to end today with 3 general opportunities or suggested opportunities for expanding the complementary therapies offered through Little Red Door. The first category or objective I labeled encourage. So on top of all the great benefits that we talked about of complementary therapies for individuals in active treatment and survivorship, there's a lot of evidence, specifically NCCIH-funded research, that's being published around how complementary therapies can be beneficial to overall improving preventative health behaviors and ultimately cancer prevention, which obviously is still an objective for Little Red Door. There are specific studies that are linking yoga to tobacco cessation and mindfulness-based stress reduction to weight loss interventions, which we know can be cancer preventative. And then again, exercise is also proven to promote health and wellness in general populations as well as increase survival in cancer populations. So encouraging not only those in active treatment and survivorship, but the general population to utilize the full benefits of complementary therapies through preventative health is suggested and proven that it will be effective. In fact, up to $14.7 billion out-of-pocket expenses by the general population in the U.S. are spent on complementary health practitioners and $30.2 billion out-of-pocket on complementary health approaches. So these are already something that people are willing to invest their money in the general population as well as cancer populations. So encouraging this and granting access to those that might not have financial accessibility is important and encouraged. As far as expanding the program, I know we mentioned that over 1,700 clients received complementary therapies through Little Red Door, but that 1,700 was only 6% of the number of clients that utilized all services at Little Red Door in the year 2015. So we want more than 6% to really maximize the benefits of these therapies. And one way to do that is making sure that we're implementing formal assessments of our client population. As we've seen through the research, some complementary therapies may be more effective for certain cancer sites. That also, some of the research which was not included in the presentation, which I included a couple examples of, is some of the racial implications and cultural implications of complementary therapies. For example, Little Red Door has a very high African American female population, and there's a large body of evidence examining how that interacts with spiritual techniques and religious techniques. One study found that African American breast cancer patients reported that interventions that did not include prayer or spirituality were considered to be culturally incompetent. So we definitely don't want to implement anything that people feel is not inclusive of the population that it's meant to serve. Another study on low-income African American breast cancer patients found that those who were able to communicate a deep religiousness to others through a support group were found to have lower levels of negative emotions, higher levels of perceived health self-efficacy, and higher functioning and well-being. So with evidence like this, that spiritual techniques resonate and are so effective within this specific population, those are things we don't want to ignore when we're taking the steps to expand this program. So ultimately, major objectives for expanding are doing formal assessments and making sure we know who we're working with and who we're trying to help. The last objective or suggested opportunity would be engagement. And this goes back to the idea of an integrative oncology model. As an organization who is planning to offer complementary therapies, we want to make sure that if an integrative oncology care plan is kind of the gold standard that is supported by the NCCIH, that we want to make sure we're supporting that as well. So from the research that we've seen in populations with low health literacy, we know that we need to be educating clients about complementary therapies. Make sure they're aware that these are out there and that they can be beneficial to them. encouraging clients to discuss complementary therapies with their oncologists. We can even go as far as implementing a communication strategy between the complementary therapists at Little Red Door and the oncology teams that work with our patients or our clients, making sure that communication is open. As well as implementing formal quality assessments and tracking methods for our programs is also another way to really communicate the facts and the effectiveness to the oncology teams, as well as just generally making the medical community aware that these therapies are offered here. Again, some therapists might think about recommending a complementary therapy to a patient, but if it's not financially accessible to them and they know that there's that barrier, they might not bring it up. So knowing that they have free resources or resources that are more available to that patient might encourage them to discuss that and recommend that for their patients. So I thank you all for listening to all of the information presented today. I know it was a very wide overview, very inclusive. So these were kind of the wrapping up and opportunities that we saw in complementary therapies here at Little Red Door. And that's pretty much all I have for you guys today. Thank you so much for listening.